discussions about oral health. Pregnancy and childbirth are often viewed as a woman's responsibility, but the journey to safe motherhood involves more than antenatal visits and delivery, from emotional support to shared decision making and timely access to health care. And we are discussing this morning male involvement in maternity care. Interesting conversation. So both men and women, come close. You need to listen to this conversation.
Especially the men.
Especially the men. Joining us this morning to do justice and share insights on this conversation, we're joined by Dr. Veronica Iwayemi. She is the program manager, Lagos State Primary Healthcare Board's Reproductive Health Program. You're welcome, ma'am.
Thank you. Good morning, and thank you for having me.
You're welcome. Good to have you here again. So when we talk about male involvement, especially when it has to do with pregnancy, like I said in my intro, when you talk about pregnancy, it's often seen as a woman's issue, a woman's responsibility. I'd like you to break that down.
So male involvement goes beyond, it's a woman's business. It's actually, it's our business, because in the process of making the pregnancy, it was a joint venture. And so, as we're expecting our baby, it should be a joint venture. Think of male involvement or pregnancy like you're driving your car. You want to go on a journey, a 9-month journey on road. You're not going to just get into your car. You're going to service it. You're going to fuel it. You're going to make sure the brake system, everything is working right. And this is a long-term journey, right? And you have your children, your family in that car. The same way pregnancy is. Now you're going on a journey. You're not going to leave your wife, to go out there on her own. You jointly made this baby. And so you must jointly work together during that journey. So it's about being involved. It's about being intentional and being informed. And also it's about partnership. So you want to be there. You want to be present. You want to know what are the danger signs? What does she need? You want to be there for her, even at home, when she goes for antenatal visits, and also knowing what are the things she can do and cannot do. So in essence, it is about being intentional, being present, being informed, and also ensuring it's a partnership.
Okay, being informed, being present, being in partnership. Okay, like you said. For most of our men here, they will say, am I going to carry the pregnancy with you? Okay, the most they can do for you is, by being involved, maybe drive you to the hospital,
or give you money
or give you money for Uber, so that you can enjoy comfort. What do you really mean by being involved, when especially it is only the woman, carrying this pregnancy at that time? What are the men supposed to do?
So, as a man, yes, it's good. Money drives a lot of things, right? So one of the things, it's not just providing the money. For instance, you should ensure she's enrolled on insurance, because that is also helping you in terms of any unforeseen emergencies. So enrolling her means you're intentionally taking care of any unforeseen event. 2, you drive her to antenatal. You can go a step further. Go in together. Hear the doctor tell her about her health conditions and everything. Because God forbid you have an emergency and you have to drive her to the emergency room. And they're asking you questions about your wife. Before you marry her, we play these games. They say, let's see how much you know about her. What's her favorite color? What's her this? You should know what her medical history is. You should be able to tell the emergency room doctor, my wife has this. These are the drugs she's on. It's about knowing your spouse, your partner. So it's not just driving her there. That's good. It's also going in for antenatal with her. And the good thing is, in Lagos, we do group antenatal care now. That means, unlike the traditional antenatal when it's just the woman that comes in, your mother-in-law can come, your husband can come, your brother. Look, all your family members can join you, because we are trying to make sure that everybody is involved in your maternal care. So money is good. We love it. but your presence can save lives.
Okay, your presence can save lives. I also want to find out, is it, why do men really stay away from their responsibility? Is it a culture thing or is it an ego thing?
I think it's more of a culture thing.
Okay.
You know, just like you said, we believe pregnancy is a woman's business. And they're thinking, the same way, you know, we have some cultures that say, I won't let a male doctor see my wife and so many things. And if a man at work says, I'm going for antenatal, they would say, kilo la shimbe. Are you the one going to help her deliver? But if he said, I want to take time to go and watch football, nobody's going to think,
that's a man
I mean,
thing.
that's a bad thing. You see, it's a culture. It's like, it's not your business. But we need to change the culture. The same way as we're bringing our young boys up, we need to change the mindset of, you know, traditional roles. Because now it's a partnership. So you can go there, you help her, because again, when you're there, it's supportive. She knows that her husband loves her because you're taking time intentionally to be there with her. So it's not just you're giving her the money, but you're also showing her that I'm here for you. And you know, women value that emotional connection. It strengthens your family. So it's not just the financial, it's the physical presence, the emotional presence. And that's what makes the difference.
Especially when, you know, a woman is pregnant, your hormones are working up. You can't even understand how you are feeling. You are happy. You are happy this moment.
You're
the next
crying.
moment, you are crying.
You know,
after crying, you are eating.
Yes, you know.
Okay, so, I want us to talk about how much involvement should the men be, especially when it has to do with tackling maternal and natal death. What should men be aware of? What are the warning signs that a man should be aware of and see, especially when the wife is pregnant?
So they need to be all round involved, because at home she's going to need rest sometimes. You know, pregnancy, it's like we normally have a pregnancy simulator we use in our clinics, because now we have a new intervention we call Men in Maternity, so that you get to know what goes on in her body. So you can imagine trying to pick things up, trying to cook with the weight of a baby. So sometimes she needs to rest. And so being involved, the man can help with the home chores. Being involved is also when you go for the antenatal and you know the danger signs. If you now hear she's having severe headache, not just a normal headache, something like my head is pounding and you know this is an emergency, you recognize it. Because then with your roles, you can save her life. If she's bleeding or even spotting, you know, because you've been at the antenatal clinics, you understand these are danger signs.
Normal.
You don't take it lightly, and so you can take her to the hospital in real time. But not having those information, you're just going to think, you have headache, take Panadol now. Whereas this is not the regular routine, I have a headache, and you just leave it and take a risk. So your involvement can save her life. And so you must know. So apart from that, yes, we want to give money. Now, even if, you know, families tend to come and there are so many interactions in between, you become her emotional support in trying to make your family understand why she needs rest. Because it's assumed you're a woman, you should be able to handle pregnancy. It's not a big deal. Or especially if you've had one before. But every pregnancy is never the same. So the assumption that because I've had one baby, oh, come on, it's routine, you should be used to it now. And that's where the emotional support comes in, when your husband is able to shield you and help you. And, you know, it goes beyond just the money. But then we like the money, you know that.
Okay, we often see some men who disappear, you know,
when the baby is born.
When the baby is born, of course, they will give the wife all the support, you know, when she's pregnant, give her all the care. But they disappear once the baby arrives. You know, what kind of support can a man give his wife after delivery?
So after delivery, and I want to use this opportunity
Because they often say, but my mother is there.
yes,
What do you want me to do?
again, it's a woman's business. My mother is there.
My mother is there.
And the thing is, even the baby has to have connections with the parents. And so when your wife delivers, as Lagos State government, we understand that the role of a man is equally as important on the job as it is at home. So the first thing we do, you're expected to apply for paternity leave. Lagos State is, if I'm not wrong, the only state, I think, that gives paternity leave to fathers who have just, yes, 2 weeks. So you can be there at home with her. The shopping, we have cultures that say you can't go out, you can do so many things. So he can help her in trying to procure things, ensure, and even when she needs to sleep, there's nothing that says a man can't carry his newborn child. I mean, you can carry, the child can sleep on yours. And then you've seen pictures of fathers who back the babies. Yeah. Yes, because again, it's connection. Each time the mother carries that baby, the baby is looking at your face. The same way the father can carry his own child. The child starts to recognize, because they do recognize after a few months, the faces, they recognize colors and all. And that's why you see the bonding. And that bonding is essential. So they can actually stay at home, help with chores, help with moving around and getting the things that are required in order to be able to nurture the baby.
So also, I want to talk about, okay, sorry, I should have said this before the question I asked. During delivery, yes, are fathers or men allowed into the theater or delivery room? Because I've experienced one before that the man, really wanted to go in, but he was bad. And there was another experience that, the wife wanted her husband in, and he was like,
I'm not coming.
No way, I'm praying outside. I'm praying for you out there.
So during delivery, excuse me, there's no rule that says a man can't come in. The only thing is it depends on the structure of the facility.
Okay.
If the facility is structured such that it's a general labor ward at the delivery room, there are wives of other men.
Okay.
And in this case, you're exposed. And that's the only reason, really, why they cannot. But if you're in a private delivery room where everything is structured to take that delivery and it's just your wife, nothing stops you from even wanting to take pictures or even recording the birth of your child. So it's normally the structure of the center, the facility where you are, that will determine whether you can be permitted there or not. But not that, we don't want the men in there. And we're galvanizing towards that, because now across our facilities, even in Lagos State, there are private sections. So if you request for it, I'm sure that can be accommodated. Of course, with old facilities and buildings where it requires a lot of renovation, reconstruction, those constraints will still be there.
So I've also seen cases or heard of men fainting, in the delivery room. So could you share some tips to help men strengthen themselves while they're entering
strength? Don't go there. Don't go at all.
Yeah, I think some men faint because, even some women can't stand the sight of blood. And blood will, whether you like it or not. So if you cannot stand the sight of blood, then please don't go. But most times, we normally have a cover. If it's a private delivery room, there can actually be a cover where you're on the side where she is, and the doctors and the midwives are doing their own job on the other side. So you're not getting frightened. And when the baby comes, of course, they clean up your child, and then you get to carry the baby while they also complete the process with your wife. So that's the thing. But again, if you cannot stand the sight of blood, please, you can stay outside and wait for us to come and tell you, congratulations, you have a girl or you have a boy.
Okay, still talking about male involvement now. After the naming ceremony, everyone that has come to visit goes back home. I think it's after 41 days. Then some mothers that came to take care of the baby and the wife will
They'll
go
leave,
back.
yes.
So how much involvement should the nursing fathers, be at that stage 6 weeks after delivery?
They need to be fully involved. They need to know the routines, like for instance, your child will take immunization. And that's why it's critical that you attend antenatal with her, because these are the things we discuss. In our group antenatal sections, we talk about birth preparedness, the immunization your child requires, the family planning, because we want you to decide how you want to have your children, when and how. And so it's necessary for you and your wife to have decided, are we taking family planning immediately so that she can recuperate? And then, of course, when we're ready, or maybe she wants to go to school after this child, when we're ready, we go off the family planning and then we come and get pregnant again, because they're reversible except for vasectomy and all. So he can help her. Again, she's breastfeeding. She needs to be eating and drinking a lot of fluids. So things like that, pap, making ogi, he can help her with that. And she just carries the bucket and be drinking, so that the breast milk is, if she has even irritated nipples and all the nipples are kind of swollen and all, he can help her. Do you actually know he can actually suck out and help her to free it, and that way the milk is coming out, pushing out easily, because you don't want breast engorgement and things like that. So these are things we teach during antenatal class. And once he is aware of this, in those post-delivery, postnatal periods, he's able to jump in. Yes, mommy is gone, omega is finished, but you're here. And because you know it, when you're around, you can still help. Or like I said, she wants to sleep. He can help back the baby while he's watching a football match. When you're watching football, hey, the baby's on his back. It doesn't change anything.
Don't touch my baby when he's watching football. She said to my baby, come and stay next to me.
On his back, he's already tired.
Lies out of his back. Okay, I have something very, very sensitive, crucial, that, earlier on I said, men disappear, after childbirth. You've mentioned breastfeeding. It is very challenging for men, especially when a woman is doing, or the new mother is doing exclusive breastfeeding.
Yeah.
Men sort of see this as, when will it be my turn again? And of course, sexual relations. At what point will a man have to wait? Do you involve men when you're doing your teachings? Do you involve that? Do you tell them that, look, you have to be patient, or this is what you have to do, while being patient with this woman?
Yes, we do, and that's why I mentioned the men in maternity, because it's a session where we, at 36 weeks, we gather the husbands and the spouses or partners of pregnant women who are above 36 weeks, and it's a male engagement session. So we start to talk to them about the various things to anticipate, even the emotional roller coaster that their wife will be going through, so that they can be patient for her and be there for her. And so we also explain to them what to anticipate. I know a lot of women, we think it's very difficult to achieve exclusive breastfeeding, but it's actually an intentional thing. If you have the storage bags, you have the breast pump, and you're drinking a lot of fluids. If I'm going to be starting work, like, again, to commend Lagos State government, our maternity leave for the first 2 babies are 6 months. No state does that. And so that allows you to stay with your baby for 6 months. And so by the time you're going back to work, there are storage bags for breast milk, and the breast milk can stay in your freezer for 48 hours. So you just drink a lot of fluids, pump out, and store them in the fridge, in the freezer. And you can take the one you want for the day out. So whoever is helping you, even when you're in at work, they know to bring out a bag, and they can feed your baby cup and spoon. We normally do not recommend feeding bottles. Not because feeding bottles are bad, but the teat of the feeding bottle must be sterilized. And we don't have all the
time, all the nuances,
the electricity, the everything. So cup and spoon, silver cup, I can see it, spoon, put your hand in, wash it, you're done with that, you know. And we encourage that. And the husband can help with that even when he comes home as well. So there are a lot of things families can do, even with intimacy. I talked about family planning. Because within 3 weeks after you've delivered, once your hormonal balance, your hormones are back and you're ovulating, you may not be menstruating, but you can get pregnant. So within 3 weeks, you could be pregnant again. And so in order to ensure your intimacy is preserved, when you go on family planning, there's no need for your husband not to. Once you've healed down there, you can go back into having intimate relationships. And that helps to also bond the family together.
I want us to quickly touch on, because our time is fast spent, but quickly touch on care for cesarean moms.
Yes. So with cesarean moms, they need a bit more care because, again, you know, they have an incision. That incision needs to be well taken care of.
Does it come like this too?
It depends.
Oh,
So for instance, it's you have it, it's like we call it the bikini line, you know, so it's not thin. But then we have histories of fibroids a lot in Nigeria, and some women would have had surgery to remove the fibroids before getting pregnant. For those kind of women, most times we will do the open laparotomy incision line. So those incisions need to be well taken care of to avoid infections. You don't want to carry heavy things because, again, we cut into your womb, unlike the one that just stretched and then is shrinking. Now you have a cut internal. It needs to heal. So you don't carry heavy things, apart from your baby. So your husband can help when you're going for antenatal, postnatal care, to carry the diaper bag and all. And then, of course, healing, ensuring that with the baby, for instance, also, you know, you have to carry the baby, the cord has to heal and all. The husband can help with things like that as well.
Thank you very much, Dr. Veronica Iwayemi, Program Manager, Lagos State Primary Healthcare Board's Reproductive Health Program. And we've been talking about real male involvement in maternal care. Thank you very much for joining us.
It's been a pleasure. Thank you for having me.
I just hope that you men, Basits, Gembe, and others that are watching us, you know, I hope you understand. I hope we'll be able to convince you and not confuse you. You know.
How to drive your car.
Exactly.
Your car
but on a serious note, maternal health care is not just about the woman. It's also about you. It's about support. It's about showing up. We'll be right back after this short break.